I do not want to turn this into media bashing, to be clear, but it does raise a serious question. And the question it raises is, who drives the alcohol and health debate? Is it still driven by science alone, or are there other interests behind it? My name is Anja Zimmer. I'm a wine journalist and lawyer. I have founded an agency, A to Wine and Things, which curated events like this one and does communication and journalism. And I have the great pleasure to say hello to Julian Braithwaite, who will be straight in the heart of this debate and bring us all interesting news there are. Julian is the CEO of the International Alliance of Responsible Drinking, an NGO who takes care of to reduce harmful drinking, but also speaks a lot about moderation. Before he joined International Alliance of Responsible Drinking, he served as a UK ambassador at the United Nations in Geneva and knows the World Health Organization quite well. And he has a strong commitment to evidence-based policy. We are very happy to have you here and to hear what you have to say. The floor is yours.
Thanks very much, Anja. And delighted to be here, and thank you for inviting me. So, I've been the CEO of the International Alliance for Responsible Drinking for about 2 years now, and before that I was a British diplomat and indeed spent 6 years in Geneva working, including with the World Health Organization. So I come from a background in what's called multilateral diplomacy, working with the United Nations, working with the World Health Organization, working on, indeed, evidence-based policy making, hopefully. I now run an organization which has 13 member companies. They're mainly international beer and spirits companies, but they also have significant wine interests like Moet Hennessy, Pernod Ricard and others. And so we have a partnership council, as it's called, which is made up of all of the trade associations in the industry globally. And there are many that represent the wine industry, particularly from Europe. So we have a real connection also with the wine sector. It's one of the reasons I'm here today. Well, since I've been doing this role, we've been looking, and I've been coming at this relatively fresh, looking at this whole debate on alcohol and health and what it means for the industry, what it means for different sectors, including the wine sector, how we can engage in that debate, engage in the policy-making processes around it, and help ensure, indeed, that policy remains based on the evidence. So, as Anja said, in the last couple of years, and this has really struck me doing this job, is that this alcohol and health debate never seems to be out of the news, at least in the Anglo-Saxon media. So in the British media, the American media, there's front page articles in the New York Times about the latest research on alcohol and health. You've got wellness influencers all giving up alcohol. You've got the sober curious trend. Social media has been turbocharging this debate. Millions of posts every year. You've had a trend about Gen Z, are they stopping drinking? Are they becoming an abstainer generation? And of course, you've had the thing that sounds most alarming of all, which is the scientific studies about alcohol and cancer and the links between the two, and if they exist. And all of that has become much more part of a debate which in many ways feels now quite polarized about alcohol and health, but also very prominent and stretching not just from the media like the New York Times or the broadcast media, but particularly active through social media. And there's this concept of no safe level. The idea that new science basically says that there is really no safe level of consumption. There's, all alcohol consumption is harmful. This particularly links to the links between alcohol and cancer, the alleged links between alcohol and cancer, and those are the headlines that drive a lot of the sort of the public and popular understanding of the debate. And part of this, and you'll read about this, is data that suggests there's an alcohol crisis. Numbers of people dying from alcohol attributable causes globally or nationally, data suggesting that those are going up. A sense that there's a crisis that requires more of a policy response. that actually the science has changed, the data has changed, and therefore policy should change. That the old ways of managing alcohol health policy are not enough, and so different types of policies should be introduced. And you may sometimes have heard of people using the analogy of the tobacco industry and things taken from tobacco regulation that could be applied to the alcohol sector. You've had the debate about whether you need warning labels on bottles, graphic warning labels with the links to cancer, liver disease very graphically displayed on them, like the tobacco. All of this obviously sounds incredibly alarming to an industry that has fantastic products, great branding, beautiful bottles, presented very beautifully. The idea that this would be part of your future is obviously really alarming. So has the science really changed? And I've just introduced my little organization a bit. So the International Alliance for Responsible Drinking is based in London and Washington, DC. We have a team of analysts, science analysts, who track the debate on alcohol and health, the scientific debate, the literature, the research on alcohol and health. We don't do any research ourselves. We just look at what's out there, and we look at the most serious pieces of research that are out there, and we analyze them. And so my team have been tracking this for many years. IARD's been around in its current form since 2015, but the predecessor organization goes back to the 1990s, so we've been following this debate for a long time. And one of the sort of the key ways of looking at the science over time are these big studies that get done every year or couple of years called meta-analysis studies. And this is where scientists get and pull all of the science on alcohol and health together, all of the what's known as the observational data, where people have been tracking something called all-cause mortality, which is basically what is the link between drinking alcohol and averaged over time and over populations life expectancy, all-cause mortality. And there's been, over the past 25 years, there's been a bit over 20 of these big meta-analysis studies. And right up to today, what the consensus shows is still something that looks a bit like this. This is known as the J-curve. And the J-curve, when you average out over populations, when you average out the risks of drinking alcohol, shows a dip and then it goes up again. And so when you're drinking moderately, yes, it is true that there are links. There are absolutely links between alcohol and cancer and certain forms of cancer. Breast cancer, there is a link even in moderation. So no one should be saying that that's not the case. But when you average it out over all of the other effects that alcohol has on your body, whether it's on diabetes, cardiovascular disease, you add them all up, you average them all out, you have this J-curve. So it's very different from, say, other products, not to mention tobacco, where you don't have a J-curve, you just have a straight line. There is no safe level of tobacco consumption, but alcohol is different. It's a different product, it affects the body differently. The science over 25 years of these analyses still shows, broadly speaking, this effect. There's been a lot of scientific debate about something called the sick-quitter bias. I don't know if any of you have heard about that, but those who argue that there's no safe level say that this effect is accounted for by the fact that the people who no longer drink alcohol, many of them are very ill because they used to drink alcohol, and so it skews the bias in favor of people who drink. People have controlled for that, and you still get, in the majority of the studies, this sort of pattern. So that's really the consensus of the science still today. It all got pulled together most comprehensively by an organization called the National Academy of Sciences, Engineering and Medicine. It's a US-based institution. It's a state institution founded by Congress in the 19th century to advise the US government on questions to do with science, engineering, medicine. And they were commissioned by Congress back in 2023 to do a review of the evidence on alcohol and health, of the science on alcohol and health. And they did a comprehensive review. They appointed a panel of distinguished experts from across the United States relevant to this study. They carried out a very robust review of all of the science. Their methodology was published and transparent and peer-reviewed. It was a very high-quality review of all of the evidence on alcohol and health. And it has some very well-judged and carefully worded conclusions in its study that was published at the end of 2024. And one of the key ones is that they say that the evidence still shows that people who drink moderately will live at least as long as people who don't drink at all, which is basically the J-curve for you. So, one of the things I want to be absolutely clear about, and IARD is very, very, very clear about, is we never recommend drinking alcohol for your health, right? And no one should do that. But the point about the J-curve is that drinking in moderation is different from harmful drinking, different from excessive drinking. And they have different impacts, and that actually if you drink harmfully, you have this very rapid increase in the harm that it does to you. But if you drink moderately, the NASEM conclusion, the National Academy's conclusion that people who drink moderately live at least as long as people who don't drink at all, that is what the science says. It's very, very important for this industry, very important distinction between this industry and others. And so the other concern, is alcohol harm increasing, the sense that there's a crisis? One of the pieces of data that you'll sometimes hear is that 2.5 million people die of alcohol attributable causes every year, which sounds like a lot. It sounds like a crisis. 2.5 million people. And that's official UN data. But what is also true are the trends. And one of the, there's this awful UN metric called alcohol attributable mortality, which is measuring the impact of alcohol in terms of mortality around the world. And the UN has been commissioned, specifically the World Health Organization, has been commissioned to track that data. And they published data in 2024 showing that there had been a 20% decline in alcohol attributable mortality globally in the decade from 2010. I've been working in government a long time. If we saw a 20% improvement in the situation in a decade in anything to do with public health, we'd be celebrating it from the rooftops. So that is an extraordinary bit of data, which you don't often hear very much about, but it is official World Health Organization data. It takes you up to just before the pandemic, and so what happened in the pandemic is another story, but it's really important to understand that those trends are going in that direction overall. So is there a growing global crisis on alcohol and health? No, there isn't. That's the curve. That graph comes from something called the Global Burden of Disease data, which is the best data series globally. Actually better than the WHO's own data series because it comes into the 2020s. And that shows exactly the same trend. You see the decline over the last decade, over the decade since 2010. You've also had declines in what's known as HED, another thing that the UN recognizes, heavy and episodic drinking, binge drinking to the British tabloids, and APC, alcohol per capita consumption, which isn't really a measure of harmful drinking. Obviously, it's a measure of average drinking. But that is also coming down. There's a UN target that it should be reduced by 20% from 2010 to 2030, and the world is on track for that. So, on all of the big metrics in this area, this sector, the alcohol and health agenda is moving in the right direction. And where there's been the most progress, well, you might not often hear about it in the newspapers in Europe, is actually in Europe. There's been a 29% reduction in alcohol attributable mortality in the decade from 2010. Other parts of the world have seen real progress as well, which is why the global data has moved in that direction, particularly in China. 1.5 billion people in China. When things go right in China, you see it in the global statistics. China's also made a lot of progress. Where you don't see it so much, and in some parts of the world it is going in the wrong direction, are in these small island developing states, some other parts of the developing world. So you've probably heard, this no safe level idea, and also that the World Health Organization is also saying that there is no safe level. You may have read about that. I showed you a little infographic that WHO Euro, which is a regional organization of the WHO, had produced earlier about no safe level. Where that comes from is actually a very now famous article from January 2023 in The Lancet, which is one of the great journals of medical record globally. And a number of WHO officials wrote an article saying there is no safe level of alcohol consumption. And that got reported very widely. It got reported very widely as the WHO saying that. Now, what they were very clear to say in their article is that they were speaking in a personal capacity and they weren't speaking officially for the World Health Organization. Now, the reason that matters is the WHO is an intergovernmental organization and its policy is set by its member states. It has 192 of them, and they approve the policies within which the WHO works. I know that because that's what I did for 6 years in Geneva, and that's the way this organization works. And the most recent example of the member states giving direction to the WHO came from last year, actually. And in the UN, there was a political declaration on the prevention and control of non-communicable diseases, and that confirmed the overall strategy. And the overall strategy, let's see, is based on 2 key pillars of policy. And critically, it's based on the distinction between the harmful use of alcohol and moderate consumption. This is the UN's global strategy to reduce the harmful use of alcohol. It was approved in 2010. Last year in New York, the United Nations overwhelmingly endorsed it again as the basis of policy. That's really important for all of us because it means that public policy should focus on harmful consumption. In other words, excessive consumption. And that moderation, people drinking moderately, is a matter of adult choice based on information, but it's a matter for choice for them. And that's because the science distinguishes clearly between moderate consumption and harmful consumption. So that's pillar number 1, really important. And it is the basis in which national policies also work. Pillar number 2, really important for all of us, is that actually there's something that the UN calls the whole of society approach, and that means that the private sector is part of the solution. So when it comes to tobacco, I'm afraid, probably very rightly, the tobacco industry is excluded from public policy. They are not part of the solution. Our industry still is. There's something called the whole of society approach, which means all of the big companies, all of you, are all part of being part of the solution. We can partner with government. We have responsible marketing, responsible advertising, responsible sales codes, and those are seen as a contribution to the overall solution. And it's the reason why my organization is recognized by the United Nations as an NGO, because we represent the industry in all of those multilateral discussions in New York and Geneva. And we have a legitimate voice because our sector is a legitimate part of this whole of society approach. So it's a really important second pillar. Now, both of those things have come under threat. There was a big challenge to them last year in New York, but actually the member states did not agree to either exclude our industry or to shift policy away from that focus on the harmful use. So that was a victory by the member states over advocates who were pushing for change. So when you read about all of this talk about change, the reality is that it's still focused on those 2 twin pillars which are very important for our industry. And the key question is what is working, because if we're seeing this progress over the last 10, 20 years, what are the things that really work? And it's things like tackling drink driving through proper statutory legislation and proper enforcement. It's through things like having proper legal purchase age properly enforced. It's through the targeted interventions that help people who do have alcohol use disorders, and it's through proper consumer information, and that's where, again, we play a role because we can provide information, appropriate information, to our consumers about this. So, what next? I think for all of us, and I think this includes the wine sector and all producers across the sector, it's about taking that responsibility agenda seriously. Yes, we have a voice in this debate. Yes, we're seen as part of the solution, but we'll only continue to be seen as part of the solution if we show we are part of the solution. And so that is about demonstrating our critics wrong. It is about showing that we are part of the solution, providing consumer information, showing that we are supporting responsible marketing, advertising and sale. And that is how this sector, the wine sector, but also the industry more widely, keeps its license to operate, not just in a sort of legal sense in public policy, but in the court of public opinion as well. IARD has a whole series of interventions that we do on behalf of or through the companies and associations that are members. Many of your trade associations are part of IARD, so you're already participating in this. I'm delighted to take any questions you may have later, but I'm going to stop now and hand back to Anya and the panel for the discussion. Thank you very much for your attention.
So, thank you very much. This was a great and inspirational speech and a good bridge for our panel discussion. I would like to invite our two panelists to come here. Tom Croghan, he is a physician, cellular immunologist. Yeah, we need, can we get the slide? Health policy researcher, but he's also a winemaker with a vineyard at Dodon in Maryland. And Felicity Carter. She is a founder of Drinks Insider, my English today, director of ProWein Global for the edition part, and she is the sharpest observer of how politics, public health, and media narratives shape the drinks debate. Welcome, both of you, and have a seat. So, Tom, I start with you. We heard a lot now about the state of the science, what studies say, what studies don't say. Can you go a little bit more into it? What do studies really say regarding cancer, regarding health, and what don't they say?
So there's a lot of things that we do know. The first thing is that harmful drinking is harmful. Drinking too much, not good. My wife's giving me a clue to raise the thing because I do that a lot. Harmful drinking is harmful. There's no question. That's why what Julian had to say. Second, are not things that we talk much about. For example, there's extraordinary individual variation in our response to alcohol. This is because we have different genetic makeups. We metabolize alcohol differently. We metabolize acetaldehyde, which is the cancer-causing substance. And so there's a lot of individual variation. Second, the studies that Julian referenced are the way we measure alcohol consumption is really imprecise. We ask somebody, essentially, how much did you drink last week? And we extrapolate that across a lifetime. So there's a lot of messiness in that data. And the third thing is that we don't know what the policy prescriptions that are being promulgated are actually going to do with regard to the problem. And the problem is harmful drinking. So raising taxes, restricting access, say, in grocery stores, or other public health interventions, warning labels, for example. We don't know what those are going to do for the harmful problem.
I heard the fantastic podcast of Felicity Carter where she interviewed you about what alcohol does to the body and how the human body can cope with it. Can you go into this a little bit more?
So well, first of all, we're all familiar because most of us have consumed a little too much on occasion, and the acute effects on our cognition, slowing of reflexes, that's why it's really bad to drink and drive. And so we're familiar with that. Alcohol is metabolized mostly in the liver. It is broken down to something called acetaldehyde, and acetaldehyde is the compound that causes most of the problems. It has trouble with the liver, and so we get alcoholic hepatitis, for example. It can also interact, and there's a huge genetic variation with regard to cancer risk. So in the mouth, there's a lot of oropharyngeal concern about oropharyngeal cancers that may or may not only occur in people who smoke cigarettes, which are also exposed to carcinogens in the nasopharynx. But certainly that seems to be the mechanism for breast cancer. There is variation in the rapidity with which people metabolize acetaldehyde and their breast cancer risk.
And with regard to other cancers, the science seems a little bit diffuse there.
Yes, there are some that make have biological plausibility. For example, anywhere in the gastrointestinal tract, and so there's some relationship with colorectal cancer, for example. The one that's breast cancer again, that's at a distance from where it's actually consumed. The other important point here, Anja, is that there's seems to be reduced risk for certain cancers, for example, renal cancer.
Okay. We don't hear much about this in the debate. This is kind of interesting. So my impression is not the science has changed, but the framing. What, Felicity, maybe I can go to you with that.
Yes, but what has changed is there's a new form of, probably Tom should talk about it, there's a new form of study called Mendelian randomization or genetic study. And what people do is they look at, there's a gene that, actually Tom, do you want to explain what the Mendelian randomization study is?
Sure, Felicity. So we don't really understand whether Mendelian randomization, it's a potentially very powerful tool, but we don't really know what the outcomes of its use are going to be. What they're doing is taking random small nucleotide fragments called SNPs, or particles called SNPs, and they found that about 20 of them, this is little bits of our DNA, about 20 of them are related to how much we drink. And so now, rather than using that awkward question that doesn't measure very much, they're going to say, well, we predict that you're going to drink X amount, 10 drinks, 2 drinks, whatever. And then they do the regression to say, okay, let's see if we think you're going to drink that much, what's your risk of mortality? When they do that, what they're finding is that the dip in the J-curve goes away in many studies. The problem is that form of regression analysis, which is called instrumental variables, also requires that we prove that the instrument, those SNPs, are unrelated to mortality. And no one's done that. If you read the studies, I've read a lot of them, if you read the studies, it's always, that problem is always recognized in the limitations, and then they just pass it on. And no one's talked about it. No one's done those studies. My wife, who's in the audience, and I were talking about it this morning, she's also a public health researcher, and she said, how can they not study that? It is a fundamental requirement of Mendelian randomization, and yet they haven't studied it.
Yeah, it sounds a little bit not being science, but more wild guessing, or no, not wild, but guessing in a way?
I don't want to put motivations in people for people that I haven't talked to. I think most people are trying to do the right thing. But there is this sense, after many years of doing science, I found that sometimes we're more intrigued by the technique itself than by the truth.
So, and why don't we read more about these kind of things, Felicity?
Oh, because it's just much simpler to say no safe level. I mean, the alcohol research, and I'm not a scientist or doctor, but it's a real mess. I mean, there's very little research on types of alcohol, for example, or how it's consumed and patterns of consumption. And if you really drill down into these sorts of things, what kind of diet works with alcohol, what doesn't, whether spirits are worse for you than wine or beer, it's an absolute mess. It's just much easier to say no safe level, basically, and it's an easy message for the media as well.
But doesn't it mean we lie to the people? If we say alcohol is like cigarettes, then obviously the scientist gives no base for that.
No. So when we say no safe level, basically what they're saying is there's no ability to calculate the level at which harm starts. I mean, it's like radiation. In theory, there's no safe level of radiation, but we know that if you don't go out in the sunlight, you'll get vitamin D deficiency, but you can't calculate the moment at which harm starts. I think that's reasonable, isn't it, Tom?
Yeah, I think that's absolutely right. And the other thing is, it's at a population level, it's hard enough to calculate it, but at an individual level, it's impossible, because every one of you will have a different risk level for alcohol consumption or for lack of sunlight.
Yeah, and the other thing is, when you talk about cancer, you're actually talking about very small effects. But the WHO works at a population level. And when you take those very small effects and you multiply them over many millions of people, what is a small effect actually can look like a very large effect. And I think that's one of the problems as well.
Interesting.
And
So,
then you get into this problem where we're trying to split between, say, a drink every other day, a drink every day, and 2 weeks a day, 2 drinks a day. Those are very small differences. But remember, we're either trying to predict whether you're doing that, which is sort of messy, or we're asking you this awkward question extrapolating across a lifetime. The studies don't show that degree of variation at those low levels, and so that also amplifies the differences.
so why has this phrase, which obviously is not wrong, but also not completely right, become so central in the global discourse? I ask all of you.
Maybe I can take that one.
Yeah.
So the public health is downstream of what happens in popular culture. And popular culture has changed. And the most significant change happened in 2013 with Dry January. That completely changed the conversation around alcohol. And so since then we've had other things as well. I think the Apple smartwatch has been a major one where people now monitor, everything about themselves. And they've noticed, for example, that, if you drink, you probably sleep a bit less, you don't feel as good the next day, and you can actually track all of that. So I think, the WHO and other health bodies, they say things all the time and we ignore them. Like, I bet nobody in the audience knows what they said about sugary beverages a couple of weeks ago. The reason that we heard about this now is because the culture had changed in a way that we were listening to it.
But it's really amazing. If you look at I follow German media. If you look at what's happening in Germany, we have every week 5, 6, 7 TV shows, audiovisual things, newspaper things, and it's all about alcohol. It's all about the same message, and quite often it's only the one side. They don't talk about the other side. Is it only clickbaiting, or is there something else behind?
I think this term social license to operate is really important. I think alcohol is losing its social license to operate, and I think the media have really bought into this idea that there's no safe level, and therefore they would see themselves as being wrong to suggest that alcohol has some sort of benefit. I think everyone is really scared of saying that. We've also seen some very highly activist pressure as well. That can't be denied either. We've seen individual journalists who obviously have a very anti-alcohol in their writings. We were also seeing an increasingly activist group of academics and NGOs which are having an impact as well. And it's very hard, the issue is always that, they talk about big alcohol. If you're an alcohol, you're assumed to be on the side of the evil people. And if you're an NGO or an academic who's being anti-alcohol, you're assumed to be on the side of the angels. And very few people ask questions like, where are they getting their funding from? What are their incentives? But it's just taken as a given that, especially if you're a big corporation, that you're evil, and that's just the way it is.
It sounds a little bit like a framing where you test which message sounds good for the public. But you, as a journalist, wouldn't the journalistic duty to report on both sides not bring a newspaper to also see the other side and to ask from whom the message is coming, and look at the scientific relevance and also more than the relevance at the dispute of the, and have to say, okay, there are people saying that, but there is a dispute, we have to say that as well? Or am I completely wrong with journalistic standards?
You are, but I think unfortunately what has shifted is this idea that there is another point of view. And I think, we don't go around saying leprosy is bad for you, but there's another point of view where leprosy is good for you. We just take it as granted that leprosy is bad for you. And unfortunately, the social conversation is shifting so that to say, actually, maybe alcohol isn't bad for you is now quite controversial. It's a risk to say that. Interestingly, there are some voices beginning to push back a little bit against this very, very puritanical narrative. But I think the cultural moment is against alcohol. I think that's the problem.
But doesn't that mean that the industry has to change the way it communicates? What would be the messages the industry, the alcohol industry, has to provide to change that narrative?
Let me go back to the
Okay.
Felicity's comment first, and
But I'll come back to that question.
yeah. So, I think in general, in the world now, we have this. We don't respect expertise, and we don't respect science, and so that leads to polarization. That what we've been talking about is something that's quite nuanced, with a lot of individual variation. Alcohol, for some people, shouldn't drink. There is no safe level. For most of us, it's probably okay to a limit. And so making that argument is not necessarily very easy to report. It doesn't drive a lot of clicks on your website. And so so that loss of respect for expertise. But now I've interrupted Julian, and he's been very quiet over here.
My fault. I asked you so many questions, but
I mean, coming back to what's changed. Felicity's put her finger on something which has been a sort of shift in culture. I think one of the big cultural shifts we've all been through has been the pandemic, and how we all collectively responded to the pandemic, and the way in which the balance between the autonomy of the citizen and the role of the state changed in terms of a major public health crisis. And there's still a bit of a backwash from that. Public health ministries shifted into a place where they were giving lots of very firm guidance about how people should lead their lives. Indeed, that you should stay at home, you should do the following things. And we still live in a bit of the aftermath of that. I think that'll change over time. But the pandemic wasn't long ago, and it wasn't long ago when public health ministries were literally running our lives and telling us how we could live, how we should adjust our behavior in order to protect ourselves against population level shifts in mortality that the pandemic represented. And I think part of that culture persists and has moved into other areas of public health. So I think that's part of it. I think over time that will change. The pendulum will swing back a bit. But we are living through a bit of that, where public health ministries do look to how they can nudge their populations at population level to change their behaviors in order to unlock those small changes that, if you magnify them by the millions and the millions, could lead to major changes, large changes in terms of numbers of deaths, in terms of public health ministry costs. All of our finance ministries across Europe are calling on all of our public health ministries across Europe to do something to reduce the cost of public health. The cost of public health is going up and up as populations live longer. What are people dying of now? They're dying more and more of non-communicable diseases. How do you stop people getting non-communicable diseases? You stop them doing the things that are risk factors for non-communicable diseases. What are those? Well, their obesity, their tobacco, their alcohol, their pollution. Okay, stop people doing those things. There's a bit of that sort of logic going on as well. But the key point about the science, and it is very complicated, and once you get into Mendelian randomization and what is precisely the link between alcohol and 7 different forms of cancer, and what's you're sort of lost in a maze of science that becomes very complicated, sounds very scary, because whenever you mention cancer, a consumer is going to think, well, I'd like to really, really reduce my risk to that, so I'm going to stop doing that thing, right? So that's the big the headline that people see. But the key point is that the science hasn't, the scientific consensus on this hasn't fundamentally changed. There is this sort of J-curve effect. If you drink moderately, you will live at least as long as people who don't drink at all, on average, for the average person. I mean, Tom's absolutely right that every individual is different. And some people absolutely shouldn't drink at all because of their genetic and family history and health conditions. But for the average person across the population, the J-curve is there. People who drink moderately live at least as long as people who don't drink at all. That's a really important headline conclusion to distill out of or to ferment out of the science on this. And the other one is that it's not a global crisis. It's going in the other direction. So if the current strategy, which is based on the distinction between harmful use and moderation, and based on including the private sector as part of the solution, if that's working, and the global data suggests that it is, why do you need to change it? And I think getting out of the sort of complexity of the details and the scary, it's very difficult to get into a debate about, does alcohol cause you cancer or not? It's that there is no yes or no answer to that. It's all about risk, which is very complicated to understand. The person who explains it best is a guy who used to be the professor for the public understanding of risk at Cambridge University, a guy called Professor Sir David Spiegelhalter. He was also the president of the Royal Statistical Society in the United Kingdom, and he, partly because he's personally, and he's given interviews about this, very frustrated about the fact that risk is so poorly understood, particularly in our sector. He comes out in public to say, hang on a moment, guys, the risk of drinking alcohol moderately is less than the risk of eating 3 bacon sandwiches a week, for example. He manages to explain risk in ways that people can understand, which is very hard to do because risk is very complicated to explain, but that's what we're talking about. We're talking about what is the level of risk, and how do you manage that level of risk through levels of consumption, and what is the level of risk if you drink moderately. And what the National Academy of Sciences, Engineering and Medicine define moderation as is 2 units a day for men and 1 unit a day for women, which for a very long time was the US definition of moderation officially. So, one can get lost in all of the complexity of the science on this, but coming back out and understanding the big headlines and then having the confidence as industry to know that we can communicate around that and show that we are absolutely committed to tackling the harmful consumption, the harmful drinking. Insofar as we can, as the private sector, play an important role in that, we should do that and show that we can do that. And if we show we can do that, then we can preserve our position in this space, and I think also preserve the existing regulatory framework overall, despite all of the sound and fury that you may hear about it. I'll stop there.
So the anti-alcohol lobby has 3 very clear messages. Effort drop kills you, more or less. The industry is lying, and the states are bored, kind of, and that's why they don't do stricter alcohol regulation. These are messages which are quite resonating, obviously. The messages we have is we have to measure risks differently, which is absolutely right, but it's complicated. We have complicated studies. So how could we come to a better communication form that the side of the industry is heard as well?
Well, one message that's not getting out, and this really emphasizes what Julian just said, which is the trend is down in harmful drinking. The CDC, when it was still a trustworthy organization, it's the Centers for Disease Control in the United States, published a study a few years ago that we could avoid 83% of the alcohol-associated cancers if we just got drinking down to the guideline level. That's a huge statistic, and that's very simple. We can all embrace it.
That's an interesting thing. What is anything else? So we have this Bring Over October campaign in the United States.
I think everyone should just go around quoting Professor David Spiegelhalter. He's got this great slide he does, and he says 25,000 people would have to drink 400,000 bottles of gin in 1 year to have 1 adverse health outcome.
This is great. How could we promote that? We discuss this later. So I would like to come to another issue, the regulation thing. Julian, can you give us a small wrap-up? Is there anything coming from the US, from Canada, from the EU?
So look, alcohol health regulation, the level that really impacts on all of you guys is done at the national level, or here in Europe at the EU level, or both here in Europe. But the overall framework, and this is one of the reasons why I'm sitting here, and one of the reasons why the companies that are members of IARD looked for me, is because I have a background in the multilateral system, in the UN and World Health Organization system. And that system matters for this industry because of the role of the WHO and this overall global framework that's established internationally, that global strategy to reduce the harmful use of alcohol that I pointed to earlier. And I mean, the good news there is that every few years there are various processes that look at whether or not that overall strategy is right. And we had one of those last year. We had something called a high-level meeting on the prevention and control of non-communicable diseases. It's a really big UN-level program. It's part of the Sustainable Development Goals, etc. But there is an alcohol and health component to that. And all of the member states in the world vote on it at the end of the year. And on the 15th of December, they voted on the outcome document, as it's called, from this negotiation over this framework. And what they voted on overwhelmingly was to endorse, at least in the alcohol and health space, that global strategy to reduce the harmful use of alcohol. There had been people in the debate and in the negotiation advocating for a shift. They said, there's no safe level of alcohol consumption. So there's no distinction between harmful consumption and moderate consumption. All consumption is harmful. So we should change the name of the global strategy from reducing the harmful use of alcohol to reducing the use of alcohol. That would have been a big change. That didn't happen. The other thing that people were advocating for was, the private sector is part of the problem. They have such conflicts of interest. They should be excluded from the solution. They shouldn't be part of this so-called whole of society approach. Lots of people advocating for that in this negotiation. That also did not get endorsed at the end of it. So when the member states, and they're the only people who get to decide, when they voted on this at the end of last year, they voted to keep the harmful use strategy, the focus on harmful use, and they voted to keep the whole of society approach, which includes us in the private sector. So despite the attempts to shift the policy at that level, they failed last year, and that's because the science and the evidence is actually on the side of this strategy. If the data's showing that the strategy is working and that the global statistics are moving in the right direction, why change the strategy? Surely the answer is to reinforce the strategy, and that argument ultimately won the day in New York.
So this is if we look at the top level, but if you're going down, measures against advertising, higher prices, restriction of age for children, restrictions to buy things, all that what the World Health Organization is proposing. Do one of you see any signs that things are coming? Felicity, you're looking at the...
Yeah, I mean, there's a bill going through the Canadian Senate at the moment to put cancer warning labels on alcohol. People tell me it's unlikely to be successful, but it's definitely on the table. There's an NHS document from the UK that came out a couple of months ago that suggested moving towards putting cancer warning labels. So I actually think this process has started, and we might see it one day. It might take 15 years, but I think there's enough discussion. The one thing that really stops all of this in its tracks is actually wine. I monitor the public health arguments and the NGO arguments quite closely. And the thing that they've all been complaining about is they can't get any traction because governments, particularly of Mediterranean countries, don't want to damage the wine sector because they see it as a cultural good as well as being an agricultural good. So they see a tax on wine as being a tax on culture. So the governments of particularly Italy and Spain have been, not France strangely enough, but Italy and Spain have been very strong about standing against some of this because they see it as an attack on their fundamental nature, not just a discussion about alcohol.
Yeah, it's funny that you said especially France doesn't do it. They have very strict regulation, and then it's a national state regulation. They have very strict regulation on internet advertising and other things. It's really extreme. But Julian, you want to say something?
No, it's really interesting. I saw all of this playing out in the last year, and the wine sector is, has real weight in these discussions because, it's, there's lots of employment connected to it. It's about agriculture as well. There is a sort of cultural weight to it that's very significant too. So you have agricultural ministries are interested in this, trade ministers are interested in this, and governments are interested in this. So in France, you did see the French position change as the negotiation last year went on. At the beginning, the French position was set out by the French Public Health Ministry, which sort of is part of the public health community that's sort of focusing on no safe level and nudging people to stop doing those things that give you non-communicable diseases. So they were in the same position as members of the WHO Secretariat on this. But as the negotiation went on and this issue got sort of brought to the heart of the French government, you started getting other parts of the French government involved, including the Élysée Palace, President Macron's staff, and then the French position moved into a position where they said, look, we need to have a balance here, and actually if the evidence shows that the existing strategy is working, then why should we adopt measures to change it? And so the French position changed in the course of last year, but you're absolutely right that Spain, and particularly Italy, were very joined up right from the start on this, because of the wine sector, which is so important in those countries.
So if we look at the different alcoholic beverages, and maybe you might kind of answer it with your member, but should wine kind of liaise with the others, with beer, with spirits, or should wine try to get an exception because of the cultural heritage thing?
No. No, because once you start doing that, wine has different sectors within itself as well. It would be very easy for, people at the high end of wine to say, this has nothing to do with us and so on. The stark reality is at the global level, spirits actually pay for a lot of the lobbying that goes on. If you took the spirits contribution away, wine is so fragmented and it doesn't have the resources to take on some of these issues. Just from a practical point of view, but also from a sort of civil liberties point of view as well. Some of this is about attacks on lifestyle and attacks on people's decision making. And why shouldn't you have a gin and tonic or a Negroni or whatever as well as a glass of wine? If you're drinking moderately and you're drinking responsibly, why not?
Just to come in on this, I mean, in the end, the way governments regulate this sector in the sort of alcohol space and health sector is they don't say, well, we've got an alcohol and beer strategy, we've got an alcohol and spirit strategy, we've got an alcohol and wine strategy. No, they all have. They don't have a beer and health strategy, a beer and wine, a wine and health strategy, and a spirits and health strategy. They all have an alcohol and health strategy. So it's about alcohol and it's about levels of alcohol that matter, and that's always going to be the case. That's why the UN strategy is called the Global Strategy to Reduce the Harmful Use of Alcohol, not the Global Strategy to Reduce the Harmful Use of Beer or the harmful use of spirits or the harmful use of wine. And that's always going to be the case. So when it comes down to it, the sort of the policies are going to be linked to alcohol. But when it comes down to actually engaging in the debate and with governments, absolutely wine should have its voice and be there representing the whole of what wine means to France or to Italy or to Spain. Beer should do its own thing as well, spirits their own thing. But they should work together because together they are much stronger than if they're working separately and fighting each other. That's the history of prohibition in the United States, if you want to read up about it, is these sectors fought each other hoping to get special exceptions, and guess what? They all got hit by the eventual regulation got introduced, and their voice was lost because they were fighting each other. So in order to ensure that the voice is collectively heard, by all means, play to different strengths, represent the wine sector because it's such a sort of emotive and culturally powerful voice, but do it as part of a common strategy.
And I have to say, Anja, that as a clinician, trying to explain the differences in the various types of alcohol to an individual patient who I'm already having a complicated conversation about their individual risk is just way too complicated for a few minutes in the exam room.
Okay, before I come to final round here, any questions from the audience? Now is your chance to speak up. Yeah, there's one, and there's another one. So, there? Oh, okay. You're next. One over there. Yep, on the last row.
From a consumer perspective, does it matter if the two doses of alcohol come from spirit or wine or beer, or doesn't it matter? And second, from a medical standpoint, can you talk to one of your patients and give them the let's say the responsible consumption or the moderate consumption level individually?
Yeah. So the second question first. Can I have a conversation? So let's talk about breast cancer as an example. First of all, if you're a man, your risk of breast cancer is much lower.
I assume that's right.
Women who carry the BCRA gene, the breast cancer-associated gene, which inhibits DNA repair, and that DNA is damaged by acetaldehyde. So if you're a slow metabolizer of acetaldehyde, you're much more at risk of breast cancer. If you have that gene, I'm going to recommend that you have much less alcohol. So yes, we can, in the context of an individual exam, very simply say, you're more at risk. And the first...
And on the other hand, you're less risk also.
Yeah, that's right.
You can go to 3 units of alcohol per day.
That's the variation. Exactly. And your second question had to do with...
If the source of alcohol from spirit or beer or wine, does it make a difference?
You know, well, alcohol itself, probably not. Alcohol is alcohol. Beer and wine tend to have more phytonutrients in the mix. That may make a difference, but no one's shown it. I wouldn't talk about it. I just wouldn't worry about it.
Okay, that's another question over there, and then one in the first row. And another one in the first row. So, keep it short.
Thank you. 2 questions. The first question is, politically speaking, what is the lobby groups that are going against our industry and the lobby groups we have going supporting our interests? What is the balance of power between those? Number 1. And number 2 is, if we are free, mature, and adults, why do we have to dance in this festival? Why can we not, as free men, free women, mature adults living in mature democracies, why do we tolerate this regulation? Why do we have to play, like Julian says, be part of the solution? What solution? What is the problem? This is my real idea as a producer and commercialization, 5th generation producer. I really find it frustrating that we tolerate this incursion on our freedom, on our way of life, on our culture. Thank goodness that you mentioned that about Italy and Spain and how important it is for us and how we see the wine world, and tolerating these ideas from non-producing countries that wine is ethanol. And those 2 questions, please.
As a lawyer, I would say democracy means majority in decisions, but give it to you.
I mean, just on the sort of the balance. I mean, there's a number of sort of coalitions of NGOs who are promoting action to tackle these non-communicable diseases. There's communicable diseases are infectious diseases. Non-communicable diseases are things like cancer, liver disease, diabetes, cardiovascular diseases. 70% of the world dies of non-communicable diseases, and there are all sorts of coalitions designed to try and help change that and change behavior, change policies. And in those coalitions, there are 1 or 2 organizations that are just focused on alcohol and health. And when you look at their histories, they often have very distinguished histories going back many decades, indeed, back to the 19th century, as temperance organizations. So as organizations who have always been committed to getting people to stop drinking alcohol, often for reasons that started off as moral reasons. But those organizations still exist. They have transformed themselves into health NGOs and development NGOs, and they're part of these coalitions. And they're very influential within those coalitions on the issue of alcohol and health. And they have quite an influential position in a number of places. One of them is actually on the advisory committee of the World Health Organization, which is slightly surprising. So you do have those organizations, but they're NGOs. They're not really mass participatory organizations. They get funding from various different sources, as Felicity alluded to. So the agendas behind them are often opaque because you don't know who's funding them, and you have to follow the money to understand where the agenda comes from. So there's an interesting story about all of those. On the other side, I mean, IARD is a small organization, but we're at the center of a very, very diverse and very global ecosystem of partner organizations. Many of them are trade associations, many of them represent you guys in the wine sector, but they're global, and we work together. And last year, I think we showed that we could work together effectively and appropriately, because we do have a voice, because of this whole of society approach, in order to be part of the debate and ensure that, you know, we were advancing the data as we understood it from the WHO, that we were advancing an understanding of the science, and not from us, but from organizations like the National Academies. And in particular, we're advancing our role as a sector, as responsible companies who do understand that our products, if abused, are harmful. You know, we're not manufacturing things that, or producing things, or growing things that have no health consequences. They do, and if they're abused, they have serious health consequences, and those have, you know, consequences for society. So, you know, whether that's something that an individual grower should, be focusing on day in, day out is another matter. But as a sector, whether it's the wine sector or the wider sector, it's really important to show that we do understand that there is a problem with harmful drinking, and that we, as far as the private sector can be, are absolutely committed to being part of the solution. And showing that we were doing that was one of the arguments that was most telling when convincing governments that actually the existing strategy, which doesn't exclude the private sector but includes the private sector, is working, and that actually including the private sector was worth doing because we brought solutions to the table and we were part of the solution, working with government and with civil society together.
Another question there.
Oh, let me just answer the second.
But please a short answer, because we're really running out of time.
So if the harms of alcohol were confined to just you or me, that's our choice. But the harms are not always just confined to you or me. When a young man gets in a car drunk and then kills somebody, that's affecting other people. At the societal level, it's driving up healthcare costs that we all share. So there are effects well beyond the individual. That's why we regulate.
That's very, very right. So now,
thank you very much for all three of you, or four of you. It was really interesting, and I'm following all of you due to my background. I'm Joshua Klein. I work at the German Wein Academy. So what you just said, we try to teach the same to the younger generations, the upcoming winemakers. And in these sessions, we get a lot of feedback, which is quite critical. So yeah, you come from the wine sector, so sure, you have to show those data that wine has its benefits and stuff. And then I'm thinking about that on the long run, even though the science shows the decline or shows that there is some beneficial, in moderation, some benefits for the health, if the society switches and starts demanding stricter regulations, the heads of the states won't listen to the science anymore, right? So how can we communicate all this really focused for young generations, for young consumers, to drive future generations to this self-made choice?
So that is a big question which could have a very long answer, which I'm not going to give. But I think what can I say very briefly? I think you're right, it's really important that this is communicated. And I think the sector as a whole should see it as part of our responsibility to do that communication. We shouldn't think that it'll just be done by others, it'll just happen naturally. It's something that we need to collectively to think about and take responsibility for.
I think you saw Julian model that in his talk. He acknowledged there are problems, and that sort of integrity is it's not going to carry the day in the short term, but in the long term, it will help with the regulators, as you've demonstrated.
I think the real risk is something called denormalization. So many of the academics and the NGOs, the people in the NGOs who are working on this issue, many of them come out of tobacco control. and they want to use the techniques against alcohol that they used against tobacco. And one of those is called denormalization, which is that you don't do what you don't see. If you can remove something from normal life, people will just forget about it, or it will become stigmatized. And there's already denormalization happening with arguments around things like, should companies serve alcohol? Should there be Friday drinks? Should there be alcohol at Christmas parties? Things like that. And I think at that level, denormalization has to be resisted. You know, people have to have the right to drink at work. If they do it responsibly, there has to be company, policy in place about how you drink and so on. But I always say, if you go out somewhere and you drink, put the bottle of wine on the table, be seen to be drinking it. Like, kind of resist this denormalization message wherever you can.
Thank you. So just one last question and one very short answer. If you could change one thing, just one thing tomorrow about the alcohol and health debate in science, media, public communication, regulation, whatever, what would it be?
I have to think about it.
So I would encourage all of you to always ask the question, compared to what? So we've heard Julian say that 2.5 million people die of some alcohol-related death. 9 million people die a year globally from air pollution. And air pollution doesn't hit even the excessive levels in the planetary boundaries framework. So that's not a problem. But 4 times as many people die from that. So compared to what?
Look, I think if one thing would change, it would be that this debate takes place on the basis of the evidence. Because actually the evidence, whether it's the scientific evidence or whether it's the data in terms of the trends, is actually on the side of moderation. It's on the side of the distinction between moderation and harmful consumption. It's on the side of the status quo in terms of regulation rather than changing it. So getting back to the evidence and putting that at the center of the debate would be, if we can make that happen, that would be the one thing I'd like to see.
I would like to see more scrutiny of the NGOs, actually. I've tried really hard to try and find out their funding models and so on, and I can't. They're very opaque. That's what I'd like to see.
Great. Thank you very much. You were a great panel. I hope you all got all the information you needed here.